Appalachia is full of nature, history, and culture. But this region has a problem.
Your insulin, your prescriptions are going to be a car payment every month, but good luck to you.
One that could mean the difference between life and death.
It creates anxiety that I can't explain.
Access to health care. This week, we're in Southwest Virginia, and we're riding along with a group of people working to make sure everyone has access to health care, no matter who they are or where they live. We're looking into the challenges we're facing. Hop in for a fair and clear view of what could be the future of health care in America. This is The Race. Welcome to The Race. I'm Chris Stewart, and this week we are talking about health care. We've come to Coburn, Virginia. This is a rural town in the southwest part of the state, and it's an area where for many people, access to quality health care and health insurance can be difficult to come by. Now, that is a scene that plays out in many communities across the country, but here, there's a group of people working to make sure location is not a reason someone goes without care.
We live in one of the prettiest parts, well, we think it is the prettiest part of Virginia. We are headed to a small community of Coburn. It's a small Appalachian town here in central Appalachian Mountains.
When nurses Teresa Tyson and Paula Hill pull their RV into town, they bring a warmth that's part of the charm of these mountains.
Y'all come on in.
And help that's become scarce in this part of the country.
It's kind of like we're the forgotten people. Not only are we vulnerable, but we're forgotten, and a lot of people feel like they do not matter.
Well, we're glad to have you. The cancer rates here in central Appalachia region are just so high for so many diseases.
The two natives of this part of Virginia run the Health Wagon, an organization that sends specialized vehicles like this into rural communities to provide health care free of charge.
If not, there's nobody else out there that's responding to that need like we are.
Patients receive the kind of care, tests, and treatment that would otherwise be hours away and could be hundreds, if not thousands of dollars out of reach.
I have no insurance, wouldn't have any place to go. Wouldn't be able to, to afford anything like that.
On a typical day, this doctor's office on wheels will see more than 20 patients.
I wouldn't know where to go.
Like Elmer Kaiser.
One for the Health Wagon, I probably wouldn't be here.
The Health Wagon helped him discover he had prostate cancer 13 years ago after he had blood work done.
If they had saw me then, I'd probably be gone.
The nurses are optimistic they're making a difference in a place where struggles stretch from healthcare into the economy. This area has some of the highest unemployment rates in a state that produces less than half the coal it did in the year 2000. Yet Tyson says the amount of diseases they see have grown.
We are, a cancer belt, as we are, a lung disease belt, as we are, heart belt, we're a kidney stone belt, and we say that's a reason that we're the Bible belt, because we have people praying for all these disease entities that they have. If we're not here, the people die.
And that means the pressure is mountainous to keep this bus on the road in places that can feel tucked away from what many would take for granted.
In America, it's like they've turned a blind eye to what is going on within their own country. And so we just feel that sense of urgency every day that we wake up.
Now, there are concerns about a potential major upcoming shortage of doctors. The U.S., according to some experts, could be short 122,000 doctors by 2032. Alicia Nieves taking a look at why.
If you recently waited in a crowded doctor's office, or you called to make an appointment and were told the next available is in several weeks or months, you've already experienced the effects of America's doctor shortage.
Hello.
It has become more common for doctors like New Jersey urologist Thomas Muller
So how you been?
to practice with the packed patient schedule.
The amount of patients we see is borderline insane. I'll be the first one to say I don't think it's the best thing in the world. The things that I do to combat it is I just invest a lot of time beforehand.
Dr. Muller and the team of physicians at Delaware Valley Urology each see upwards of 50 to 60 patients a day and that still is not enough.
With the baby boomers becoming, in their 70s, there are a lot of people to be seen. The overall structure of medicine, at least as far as training is concerned, they've never really increased the enrollment in medical schools.
Unless significant steps are taken, the Association of American Medical Colleges predicts the shortage is only going to get worse. In terms of the shortage expected in the decade to come and the workload you already have, if that isn't addressed, can you take on more patients?
I don't know. I think I'm at my max. I don't think you can do a whole lot more.
To help with the issue, legislators are proposing several bills that would raise grant money for more medical residency slots and make it easier for foreign doctors to practice here. Medical schools have increased scholarships. Some have even created specific residency slots for those willing to practice in rural areas.
There are folks who think that there is a shortage. I think we have as much of a problem with a maldistribution.
Dr. Bob Motley runs Jefferson University's Physician Shortage Area Program.
We have about 50% of all physicians in Pennsylvania that are actually clustered in 3 counties, but 75% of Pennsylvanians actually live outside of those areas.
Motley's program has graduated roughly 400 doctors. Almost 80% are now practicing in rural communities hit the hardest by this doctor shortage.
There's a lot to be learned in healthcare, and we definitely have not figured it out. It's not a broken system by any stretch of the imagination, but it's things that are ever changing, and I think everyone's striving to make it better.
In addition to seeing 50 to 60 patients a day, Dr. Muller also trains residents with the approach of teaching them to handle the patient load, for now, as is.
It's not for the faint of heart, but at the same time, we do it because we love it.
For The Race, I'm Alicia Nieves.
Now, healthcare could fundamentally change in 2020, all depending on who's elected president. Annie Taylor's getting the facts on Medicare for all.
Chris, there are a lot of claims about this proposal, so PolitiFact went out to find the facts. Medicare for All is a very divisive issue that would establish one government-run insurance program to serve every American. It would cover just about any service and most prescription drugs. Money is the biggest question. Supporters say the proposal would get rid of almost all medical costs, including deductibles, co-pays, and medical bills. But one major worry is, will middle-class taxes go up to fund the plan? Senator Elizabeth Warren has the only specific plan at this point, and she says the middle class won't pay more in taxes. After government spending, her plan needs $11 trillion over 10 years. She says she'd enforce existing tax laws to raise that money from the ultra-rich. Critics argue Medicare for All would cost too much, take choice away from Americans, and raise taxes on the middle class. If Medicare for All became a law, Americans would have about 4 years to transition away from private plans. I'm Annie Taylor for The Race.
There's a push towards something called integrated care, which is a new approach that some say is vital to helping those who need it most. Integrated care blends primary health care with mental and behavioral health care. Doctors work together under one roof, sharing information and working together. The end goal is to treat the whole person, not just some symptoms, and to remove barriers that prevent people from getting care. The National Institutes of Health says about 3/4 of adults with depression see a primary care doctor. Half of those get the wrong diagnosis. Advocates think integrated care will help get people the specialized help that they need. They say this model could help end a vicious cycle. The National Institute of Mental Health says people with common physical illnesses are more likely to battle mental illnesses, and people with severe mental illnesses are more likely to be chronically ill and more likely to die early. Our conversation on healthcare continues next.